Hey, I'm back, and today I'm going to talk about an interesting case study that was done by a Brazilian doctor working with a patient who had something called Myasthenia Gravis. This condition is an autoimmune disease. That's a condition where you have antibodies, or they call them autoantibodies, that are against our own tissues. You can have an autoimmune disease to just about every single thing in your body. This particular autoimmune disease attacks the junction, the connection between your nerves and your muscles. Okay, so that's what it is. And that's going to deplete acetylcholine. You can have a lot of muscle problems, specifically in the skeletal muscle. And one of the treatments that they normally use is steroids. Autoimmune conditions produce a lot of inflammation, and a steroid is an anti-inflammatory. Of course, the problem, there's a lot of side effects when you take steroids. The amount of vitamin D that this doctor used was between 80,000 and 120,000 international units of vitamin D3. What happened was he was able to put this patient's symptoms in remission. Okay, so of course they don't ever like to say cure or anything like that, but in remission means that you don't have any of the symptoms. Why would this potentially work, and what is the relationship of vitamin D? I've done other videos on this, but if you have an autoimmune condition, vitamin D is definitely something that you want to consider, because vitamin D is not even necessarily a vitamin. It's hormone-like, and it acts like a steroid without the side effects. And the other thing that it does is it supports something called the T regulatory cells. And that's part of the immune system that has a really important function in preventing autoimmune diseases. The other thing that's involved with autoimmune conditions are viruses and other pathogens. And it's not agreed upon what causes these conditions. However, there's a lot of links and associations. But obviously, it's something that damages certain parts of the immune system. And now what happens is we have friendly fire, where your body is attacking itself. And apparently, vitamin D actually supports these cells. Now, one of the reasons why sometimes you have to use high amounts of vitamin D to create this effect is that, let's say, for example, this whole autoimmune condition was triggered by a viral infection. These viruses have strategies of downgrading the receptor for vitamin D, leaving you always deficient. And to overcome that resistance, you would have to consume larger amounts of vitamin D. And there's a huge connection between a lot of autoimmune conditions, even MS, and a vitamin D deficiency. Now, one of the concerns that people will have when they take this much vitamin D is this one condition called hypercalcemia. That means high calcium in the blood. And what happens is you may develop kidney stones. Of course, the research isn't definitive, and there's not a lot of studies that say that's going to happen. But one of the things that this Brazilian doctor did was to mitigate this or lessen the risk by omitting any calcium in the diet. So he would tell the patient not to consume cheese, for example, or take calcium supplements. So if you wanted to lower your risk for kidney stones, what you would want to do is you want to drink at least 3.5 to 4 liters of fluid every single day, because in that way you can prevent the urine from being supersaturated where you would develop a stone. The reason I created this video is basically to show you the relationship between vitamin D and your immune system, and potentially even the possibility of keeping an autoimmune condition in remission with something natural like vitamin D. If you haven't seen my video on MS and vitamin D, I'm going to put it up right now. Check it out.